Good afternoon, and thank you everyone for joining us for another session of our supported decision making. This is session 7, and today we're going to be talking about some tools that can be used to support people to live the most independent life possible, as well as can be part of person-centered planning. So thank you for joining us. Let's go to the next slide.
Alrighty, so I will just cover a few housekeeping things before we go ahead and get started. So this training has been approved for one social work CEU. If you are in need of that CEU, I will send out a survey or an evaluation at the end of the session, and you can fill that out to receive your certificate for your social work CEU. Even if you're not looking for that CEU, we still appreciate if you fill out that survey. That's how we improve for future trainings. So we'd appreciate that. If you look at the top right of your screen, there's a little smiley face with a hand. That is where you can raise your hand to ask a question. You can also use the chat box. And if you click on the little bubble with the lines through it, just to the left of that smiley face, that's where you can locate the chat box. So we will be monitoring that if you have any questions. And just to let everyone know, this session is being recorded and will be available on the OCHN website at a later date.
Thank you, Caitlin. I'm just trying to give you a quick second here. So to make sure everybody's muted. It should be okay. Next slide. Oh, no, this is one. Sorry. I'm sorry, back up. Hi, I'm Vicki Suter. I'm the Director of Rights and Advocacy. I work at Oakland Community Health Network. I want to thank our partners in this 10-month series presentation, which includes Development Disabilities Council, particularly Mary, who has been so instrumental in helping us do this 10-month training and get us presenters and help us just figure out what really is important for us to be presenting. I also want to thank our other partner in this, Detroit Wayne Integrated Health Network, Kimberly Hogoff, who is helping us get the word out and helping us to put the word out about supported decision making and supporting that effort in the Tri-County area. So thanks so much to Kim for that. Additionally, I just want to mention that supported decision making, Oakland Community Health Network does have a work group that has been working on this topic for about 3 or 4 years. We're really wanting to make sure that individuals are aware of supported decision making, that they know that they have some options and other kinds of tools to use, and that because most people will know about guardianship, but they don't know about supported decision making. So we want to be sure we're educating our community, all kinds of stakeholders, so that they are aware of it, can share that with others who may need that information. We'll give you some information at the end of our training session about where you can find the other sessions that we have videotaped and on our website, and you can send people there on the various topics that have already been presented. All right. I think that's our introductory. So we do have we're going to have 2 presenters. Unfortunately, Jan Lampman wasn't able to just join us this afternoon. She had something else come up. But we do have Mary Sheehan-Bugard, as I'd mentioned, from the Michigan Development Disabilities Council. And then also we have Sola Gwen, who is a self-advocate and will be sharing part of her story and experiences related to guardianship and supported decision making. Next slide. All right, Mary, I think this is you.
Well, thank you for inviting us to present and being part of this series. My name again is Mary Sheehan-Bugard, and my title at the Developmental Disabilities Council is that of Community Inclusion Coordinator. So when you think about that title, community inclusion, it's difficult for many people with disabilities to be fully integrated and included in their communities and the communities that they choose to partake in when it's a situation of guardianship. So let's start with, where does guardianship and LifeCourse intersect? Because this particular session of this 10-month series is about LifeCourse. So where does that intersect with Guardian? It intersects when person-centered planning comes up. So again, person-centered planning is required by law for any person who's supported by behavioral health in Michigan. But person-centered planning is a lot of tools that can be used. LifeCourse is just one of those tools. And it comes into play with guardianship when it's time for somebody to plan their trajectory or plan their life over the next year. And person-centered planning can be used by individuals not supported by behavioral health. It's a great way for people to just figure out how to get from point A to point B, whatever that might be. It could be follow-up from a surgery. It could be buying a house. If you really sit down with a circle of people that you know and trust and use different tools, there's lots of different tools that can be used to kind of put that in writing. It really helps when it comes time to making big decisions about your life. So today we're going to focus on one of those tools, LifeCourse. And it's, again, we want to talk about what happens in guardianship and then how LifeCourse can be used to support those decisions versus exchanging somebody else to make decisions on behalf of a person. So as you see on the slide there, a person living under full plenary guardianship has someone else who has legal authority and makes decisions for them. And in the case of a full plenary guardianship, it could be over virtually every life domain. One thing that remains by Michigan law is that a person under full plenary guardianship still has the legal right to vote if they are of a voting age. They still have the same requirements as anyone else to register and all of that, but even if they have a full plenary guardianship, legally they can still vote. Now, a lot of times that is made difficult under the guardianship situation. We'll talk more about that later. So consenting to and or preventing any medical or health care treatment, including sexual and reproductive health. So these are some of the ways that guardianship can kind of limit situations in people's life domains that they may want to make decisions about. They may communicate their wants and needs about these areas of their lives, but ultimately in a guardianship situation, these decisions are legally made by the guardian. And then point 2 under there, choosing how and where to handle their finances or spend their own money. Again, in a full plenary guardianship, that's given over to the guardian. Participating in legal issues, i.e. contracting or filing lawsuits, buying or selling property, and even signing a lease. Legally, that has to be done by the guardian in the case of a full plenary guardian. Giving permission to partake in any educational or vocational programs or services. Again, those programs or services are going to be looking for the signature of a guardian versus the signature of an individual. Deciding how information about them should, who it should go to and with whom to communicate things about their lives. Again, that goes to the guardian in a full plenary guardianship. Making their own decisions about what risks they may want to take in life and how, what makes them feel unsafe. So in the situation where it involves another person, a guardian may feel that it's a bad choice of friends or bad choice of relationships, but the person feels comfortable with the individual. So in a sense, the person, the focus person or the ward in a guardianship loses that ability to make a risk, take a risk. We all take risks every day, but in situations in a full plenary guardianship, that decision-making power goes to the guardian. Okay, next slide. So the person's potential rights in jeopardy are, again, deciding where to live, consenting or preventing any medical or healthcare treatment, determining when and how to travel, spending money, making changes in educational or vocational programs, participating in legal issues, signing leases, all of that, giving permission to have a picture taken and shown for publicity purposes. So if I had a guardian, I would have to ask my guardian's permission to be on this virtual training with you all and to decide to participate as a presenter. So those are the kind of decisions that are lost by the ward in a full plenary guardianship situation. And you'll remember from previous trainings and previous months, there's a difference between a full plenary guardianship and a partial guardianship. So any of all of these could be written into a partial guardianship plan. That really just depends on what the judge writes the guardianship papers as, and it's up to the judge's decision which of these areas can be turned over to the guardian to make decisions and which might be retained by the ward. Next slide. So before we go too much farther, we wanted to kind of talk about how LifeCourse materials tie us into supported decision making and different alternatives to guardianship. But we want you to hear about how this looks in the life of one family. So I'm so pleased to introduce Sola Gwen, and her full name is Chakasola. She prefers Sola. And she is going to share some information about her life story and that of her family and their experiences with guardianship. So do you want to go ahead, Sola?
Okay, can you guys hear me? Or can everyone hear me?
I think you're good.
Okay, well, my name is Chakasola Gwen. I have 3 siblings who went through guardianship. I actually have 6 siblings. The oldest 2 don't fit in the picture. They live out of state and they're already adults. So we're going to be talking about my 3 immediate siblings. Let's see. When it comes to my siblings, guardianship started early, and all I can say is that no one had any experience what we were going to be doing with guardianship. Or I should say my parents didn't have experience. They were just afraid of losing my siblings to the state. So
in the beginning, Chakasola,
yeah.
Did anybody talk to your family at all about alternatives to guardianship, or is guardianship the only thing that your family heard about?
That was the only thing that my family heard about is guardianship. After like certain number of hospitalizations, the social workers from the hospital, as far as I can remember, this is like the late 90s. This is like mid to late 90s and early 2000s. So they approached my parents about guardianship.
Okay. So that often happens that we hear about it through medical personnel. And I'm looking at bullet point 3 here on the slide. You also said that you've also had the experience of ending guardianship for family members. Tell us a little bit more about that part.
Well, this one was with my sister. My younger sister. She had a guardian off and on for her teenage and most of her adult life. She's a year younger than me. So she went from my parents having guardianship for a while, then she was okay, and then it lapsed. And then she ended up being paired with she was assigned under a professional guardian, and it was really stressful.
Okay.
So my mom assumed guardianship, and back in May, it was decided that she could end the guardianship. My mom wanted to end the guardianship because my sister was living independently for 3 years.
Okay. So I think on the next slide, we talk specifically about each family member situation a little bit.
Yeah.
On this slide, kind of a summary. Can you just summarize for the group what your feelings about guardianship are now after learning about supported decision making? So like in a few words, what would you say?
Okay. Before I learned about supported decision making, I resented them. I felt isolated, and I was frustrated over the whole thing because we didn't know about supported decision making. Now that I found out about supported decision making, I'm thinking, there's a way out of this.
Yeah. And I know when we were putting together your portion of the presentation, something that struck me that you said was it changed the dynamics of your family. Can you talk a little bit about that part?
Yes. It's like my family was dysfunctional before the guardianship thing, and then when the guardianship just started rolling in for all of them, I was singled out as the least, I should say, from what the psychiatrist told me, I was the lucky one. So I was saddled with the responsibility of helping my parents, then my mother, and everyone navigate the court system.
Right.
So I felt more like a customer service representative than a family member.
Okay. Yeah, I remember you talking about that when we were preparing. Let's go on to the next slide, because I think you, in these next few slides, you talk specifically about kind of each situation with a sibling. So it starts with your older brother.
Yeah, my older brother, he was the first one to show symptoms of bipolar schizophrenia. He was under a guardian. He went under a guardianship for a while, but he did really well. So his guardianship was allowed to lapse, and then it was terminated by our dad when he was alive. So he's doing really good.
Okay. And then this is your younger sister.
Oh, yes, my younger sister.
Careful now, I'm the baby of my family too, so.
My younger brother is the youngest. He is
Okay.
the actual baby of the family. But my younger sister, she had her symptoms were more severe than others. So she's been in and out of guardianship for most of her life until 2 months ago. But I can say that when she had a professional guardian, it was for about 2-3 years. He didn't address any of her needs. Because she went under guardianship, she lost all of her personal property in storage. He did not want to pay her storage fee. She was behind on it, so he just let it lapse. And so whatever fee she had went to debt collectors. And on top of that, she went to the guardian's preferred group homes, like adult foster care homes. He had his own network of preferred foster care homes, and those were in subpar living conditions. So she ran away a lot, and she kept complaining so much, he started charging her for every phone call and every voicemail. And then he started charging her for every letter that he sent out, including every stamp and every fax. So he pretty much nickeled and dimed her. Okay. So when 2015 came, my mom decided that she needed to take over. And so my mom was successful in that. Mm-hmm. And the professional guardian was still able to take part of my sister's Social Security, her disability, to pay off whatever leftover fees he had. So he still left her in debt. Okay. For a few months.
And then I know your mother's health kind of deteriorated.
Yeah, so my mom, she had glaucoma and she lost her eyesight between that time. But on top of that, she asked me to help her out, fill out the paperwork. She and my sister would approve all the paperwork before I send it up to the courts. And then in between that time, my sister decided to move all the way up to Kalkaska. And we all submitted all the stuff to the probate court in Oakland County, and everything was fine until they decided to hold like a hearing. I think it was like a checkup hearing they had, like for every few years. From my understanding, they did a review.
Right, every 5 years for a partial guardianship.
Okay, so at that time, my mom had a flip phone. My sister, she's legally blind and she lost half of her hearing. She didn't know how Zoom works, so I had to do like a conference call with my mom, and the court clerk refused to call my sister to have her call in. So
this all happened in court without your sister even being present at the meeting.
Yeah, well, this is like the first hearing happened. My mom disconnected. My sister wasn't there, and I had to explain the living situation to the judge. So he decided that he needed to hear from my sister and our mom. So we scheduled for that Friday. Friday came, and his clerk forgot to pencil us in. So he forgot that he forgot that he wanted to hear from us. So we rolled into Tuesday.
So even like for your family to get communication from the court on when things were supposed to happen was somewhat difficult.
Yeah.
And
So
you were kind of in a position, you told me when we were interviewing you earlier, that that's kind of where you started feeling like, hey, I'm the customer service rep for the family. Like you really had to be in that role of being kind of a support coordinator for your family and making sure they knew what was happening. So tell us a little bit, fast forward a little bit. So her guardianship was then terminated.
yeah, the judge was finally able to hear my mom and my sister, and he apologized for all the technical difficulties. So he said that, well, since she's been living independent for 3 years, he doesn't have to send it up to the Kalkaska County. So he asked my mom if she wanted it terminated, and she said yes. Sister said yes, and he's like, okay, this is going to be terminated. I'll send you all your papers, and have a good day. That
So
was pretty much it.
the court, it hadn't even caught up to the court yet that your sister had been living out of the county for 3 years. And so she'd been living independently in Kalkaska for 3 years, and then the 5-year renewal happened to come up, and that's when the court said, oh, you're not even in this county anymore. So if a guardianship were to occur, it would have to go through the county where she lives at this point. But like the courts don't necessarily know that information. You know, they don't go looking for it. They just see when a renewal comes up for a partial guardianship every 5 years before they really look at that information. And a lot can change in people's lives in that 5-year time frame. Let's
Yeah.
go on to the next slide
but
and talk a little bit about.
I wanted to add one thing.
Okay, go
This
ahead.
was the thing. When my sister filed, when she moved up north, we filed all of the paperwork and said that, and even the change of address with the court, she's like, this is a change of address. She's living up north now. The courts knew that she was living up north. They didn't care until May.
Right, until that renewal came up. So,
Yeah, so it
you
was
know,
already in the books.
even though the family was sending the proper paperwork and notifications, it just didn't catch up with who really needed to see it at the court until that 5-year renewal came up. So tell
Yeah.
us a little bit more about your older brother.
Oh, my younger brother?
I'm sorry, the
Or,
younger brother. Yeah.
yeah, my younger brother, he had a really bad mental breakdown in 2019. It was really terrible. So our so his case manager at Easter Seals was worried about him, and she came to me and she asked me, would you like to be his guardian? And knowing my experience, I told him that I'm willing to do it, but I want to be a co-guardian because because it'll be taking a whole bunch of stuff with him.
Mm-hmm.
So she couldn't find anyone in Oakland County who was willing to do the guardianship because he was already in he was already in a group home situation, and to them that was a deal breaker. They had their own preferred network, so no one in Oakland County wanted to take his case. So she had to go to Wayne County, and initially the person who she contacted agreed to the co-guardianship. So back in November 2019, everything was okay. We were in I was in communication with the professional guardian agency. So about a month later, I filled the paperwork out, and she decided to take all of his case. The professional guardian decided to take all of his personal casework home with her home to her office. So I filled out the acceptance thing as a temporary guardian. Then it came up to where they said that her agency boss told her that we need full guardianship over him. We cannot do no partials or anything. So after that, they cut all contact with me. No contact whatsoever. I have not heard a phone call from them since 2019.
Okay, let's go on to the next slide because I think you talk more about that in the next slide.
Yeah. So my younger brother, he was without a temporary guardian from November 2019 to July 2020. I think I may have called the court and I told them there's a problem. No one's going to sign anything and he doesn't have a guardian. So I received a letter from the judge at that time saying that we're going to have a hearing in July. And
so I just want to interject here that so COVID came in about this time. And so that complicated things even with getting the hearing and communicating with the court system. So look at bullet point 2 there. It says the court failed to notify everyone except the guardian ad litem that the venue had changed to a Zoom meeting.
Yeah, we did not get an updated letter stating that there was going to be a Zoom meeting or a phone number. I didn't know that I was under the impression that the court clerk said, oh, it's going to be canceled. We'll just cancel it and we'll reschedule it. It turned out that the judge did not cancel it. And I got a call from the guardian ad litem to come into the Zoom meeting. And I'm like, I had no idea what Zoom was at the time. So I didn't know how to use a camera. I didn't know how to keep it like sideways because it was looking sideways. I didn't know idea what I was doing. So here I was with the judge and the guardian ad litem who was just, she did not like me. She did not like me.
So from your perspective, Sola, you're just going through your day and all of a sudden you get this call that, hey, you're supposed to be in this Zoom meeting about your younger brother.
Yeah.
And so tell us, at that meeting, they disqualified you as being able to be a guardian.
Yeah.
So
yeah.
he ended up with a professional guardian then?
Yeah. Yeah.
Okay.
To make a long story short, I was the only one there. It was me, the judge, and the guardian ad litem. The professional guardian wasn't there. The petitioner wasn't there. And my mom wasn't there. So I was just grilled. And I was told by the judge that professional guardians do not want oversight. They do not want a co-guardian. So I was just pretty much forced to say, yes, but I couldn't say, but he needs support. I could only say, yes, he needs a guardian. And I did not get any ruling from the judge after that. They just cut off our communication because they said that because I go to Easter Seals, I'm disqualified.
Right. So one thing that struck me when we were interviewing you was that you kept trying to say, yes, my brother needs supports in some areas, but not all. And they really kept redirecting you until you said in the court, in the Zoom meeting, till you said, yes, he needs to have a guardian. But what you were trying to communicate was, yes, he needs some support. And all you knew about at that time was guardianship. He needs to have a guardian. And for them, it was like an all or nothing thing. There wasn't really any discussion of there being an option of support in some areas and not in all areas.
Yeah, but at that time, I was attending the supportive decision making work group. So I had some knowledge of supportive decision making. Mm-hmm. And I tried to say that he needs some support. It's like support decision making. I couldn't say that. So all I can say was just yes.
Yeah. So they kept rephrasing it till you gave a yes or no answer.
Yes.
Okay. So the last 2 points here on the slide, you said he told you he is yet to speak to his professional guardian.
Yes,
since July
he
of
told me,
2020.
yeah, since July of 2020, he told me this is what he told me over the phone. He doesn't know who his guardian is. He doesn't know how to get in contact with them.
Okay.
He says all he knows is that they take his money. They took his stimulus, except for the $600, to buy himself some clothes and some shoes. He had no clothes, no shoes, no coat.
Okay.
They
So he's
pocketed
had
the
this guardian
stimulus.
for a year now, and he still hasn't met the person. And then also a thing that you said was, he wants to be able to call you and he wants to be able to call people to get some support to figure this all out, but he's not allowed to have a personal phone.
Yes, there was an incident with the with him getting a phone, because he managed to get his $600 stimulus, and he managed to get himself some clothes and some shoes, and he got himself a phone. The group home manager took his phone,
Mhm.
and a lot of stuff ensued. So my cousin had to go out to the home and get the phone. So it's giving us the impression that he's not allowed to have his own phone. And whenever he calls, he can't speak for long because he's afraid that he's being monitored by the group home.
Okay. So let's go on to the next slide there. This was just, again, in our conversation, we asked you to kind of sum up your thoughts about guardianship now, having kind of experienced this with 3 family members. And this is what you said, what you see on the slide there. It starts with go ahead.
It's like, although my family, we were already dysfunctional with mental health issues and the lack of resources, the guardianships, it just strained everything. It just strained our family dynamics. And I personally felt like an employee, like a customer service agent and a family member. It's like whenever my siblings call, my first greeting is like, "Hi, what do you need?" And they're taken aback because they're like, "Oh, we just want to talk about our day," and I'm like, "Oh, that's weird. You just want to talk. You don't need anything from me. You don't need me to do something."
Yeah.
It's like my brain is hardwired to be like, they need something.
You're in the professional mode, like, okay, I've got to find supports for, all of my siblings. I can attest to that fact as well, because I have a brother with a disability and a sister that requires some medical care right now. And it really does kind of change that role. You kind of forget just to be a sister. You become the pseudo social worker or the pseudo medical person. And it can really change the dynamics of a family. So
Yeah,
I
because
want to go ahead.
my first thing is that I've been trying to help them and advocate for them since it was like 16, 17, and I'm almost 40. So I'm like, you guys raised me to be a customer service person. I don't know how to be your sister. This is weird.
Yeah, just a chit chat is different. All right, let's go
Yeah.
on to the next slide there. One question that you asked or that you brought up when we were doing the interview is, when Jan and I were talking about person-centered planning, you're like, you said the phrase, "Where was my family's members person-centered planning?" Like, where did that go awry? Like, that never happened. So, do you want to go through this slide that's on the screen now?
Yeah, it's like, we all need supporters and helpers and consultants in our lives and stuff to make good decisions, whether we have a disability or not. And my family, my family circles of people have people circles they know and trust, who can help them figure out the trajectory of what they want to do with the rest of their lives and stuff. But I know that they needed supported decision making, and I personally believe the reason why they didn't have much of a person-centered plan to begin with was because their provider network dictated that plan.
Mm-hmm.
It was basically take your medicine, show up to therapy, and that's it. Nothing else.
Yeah. So the guardians kind of dictated who was in their kind of group homes that they used, and that kind of set the tone for what was happening with your family members.
Yeah, I think the guardianship is there it's basically to enforce what the psychiatrist or the counselor or what they want to do. And to me, it's like they're just there to enforce their medical plan, nothing else.
Okay.
I mean, it's like to me, guardianship is like, well, you don't need personal property, you don't need this, you don't need that. You just need to go talk to your counselor, take your meds, eat and sleep. That's it.
Okay. Sola, I really want to thank you for working with Jan and I and being willing to share information and your quest for knowledge, more knowledge about supported decision making and tools that you can use within your own family. I guess I want to pause for a moment. If people have questions specifically for Sola before we move on to other parts of our presentation, now would be a good time to drop those in the chat or the Q&A. And Caitlin, I'll ask if there are any specific questions for Caitlin right now before we move on.
We don't have anything popping up in the chat right now. I'll just give everyone, a few seconds to type that question if you have one.
Okay, I'm going to go ahead and start the next, have you go to the next slide then. So we've heard how guardianship can look like in the life of one family and how it can change the dynamics of a family. And we understand that people think about guardianship because they care. You know, we want to believe that people are at the heart of everything, good people, and they're thinking about different aspects of a person's life and supports they might need. And so our premise is that those supports can be met in ways other than using guardianship. So on this slide, we're talking about what are those main concerns that people have. And these are the top 7 that come up when we talk to families like Sola's family, and other families around the state of Michigan. The top 7 reasons are people are concerned about education, and they think that unless they do a guardianship for a young adult who's maybe between the ages of 18 and 26 in those transition years, that they can no longer have any, information or be involved in their education plan. And that's not true. It doesn't have to be a guardianship for families to still stay involved. I can tell you I have a 24-year-old son, and, he kind of joked when he was 18 of like, now, I'm in control. And I was like, yeah, that's fine, until he went to the emergency room a week after he turned 18. And the first thing he said is, Mom, are you coming with me? Like, Mom, don't leave me. I need to ask you questions. I need your input. And so it doesn't just, you don't stop being a parent or a sister or an aunt or an uncle. That family relationship doesn't stop when a person turns 18. You're still there to give input and advice, and a simple consent form signed by a student saying they want their family to still stay involved in their education decision making or have access to their school records can be signed. I mean, we heard about that in earlier presentations. Next is safety. And there's so many things, lots of assistive technology that can be put into place to help keep people safe in, more independent living situations, more situations, what I like to call interdependent or inclusive in their community. Assistive technology can cover so many things like environmental emergencies. With GPS, we can cover helping people get where they need to go, taking their medications, all kinds of things. Medical decisions is another way. Sola talked a little bit about that with her family. The minute a person with a developmental disability enters a medical system, whether it's an urgent care or an ER or, a scheduled kind of surgery, hospitals often kind of raise this question of guardianship. I've seen that with my own brother in many situations where he's been involved in medical issues. Finances, communication, sexuality, and legal. These are the main reasons why people say, well, they need a guardian because they can't make financial decisions, or they need a guardian because they won't make good decisions about relationships or sexuality. And oftentimes what we don't hear about is all of the times that a guardianship was imposed on somebody because of this issue, and then things actually end up getting worse because they feel like they can't spend time with a particular person they want to spend time with. They hide it, they sneak away, they run away, or what we often call in the system, elope from their group home, because they have a desire and a need to spend time with a particular person, somebody they've chosen as a partner. And unless we help to provide opportunities to do that in a safe way, people will continue whether they have a guardian or not. Unless that guardian follows them around 24/7, they're going to sneak away. And those things happen in sometimes very dangerous ways. So it's really important to think about, as we've said in a lot of other presentations within this series, think about what the guardianship really is going to address. Because a lot of times we have this myth or stereotype that a guardianship is going to address all of our concerns, and it really can't. You know, you can have somebody on paper that says legally they can make the decisions, but people want what they want in their lives, and they often try, if they're told not to seek that very thing that they're told not to do. And so we see that often happen in the realm of sexuality when guardianship is imposed and the guardian doesn't agree with choices that the ward is making. Let's go on to talk about circles of support a little bit and tie this into supported decision making. So again, from a previous presentation, a circle of support is made up of family and friends and can also include teachers, employers, caregivers, co-workers, community members, and sometimes whole organizations, and sometimes also like paid staff. Community living support staff could be part of somebody's circle. They're all people that we hope have been chosen by the focus person and that they trust. You know, that's probably one of the reasons they chose them to be part of their circle, is somebody they trust and knows that that outside person cares about them and is really vested in their dream, their hopes and their dreams, and knows them well enough to know their skill level. When we hear about guardians who haven't in a whole year ever met their ward, we know that they don't have enough information about that ward to know what their skills and assets are and what their hopes and dreams are for their future. So thinking about the person in the context of their family and community is what a circle does. It just doesn't look at one aspect of a person's life. It looks at all the life domains and gets to know their strengths, their skills, and their assets, and their hopes and their dreams and their desires in each of those life domains. We'll talk more about that as we get into the actual LifeCourse tools. Let's go on to slide 12 there, the next slide. So we said that supported decision making and guardianship and other alternatives to guardianship and person-centered planning, that's where it intersects with LifeCourse. Because LifeCourse that we're going to talk about here for the rest of the presentation really is one of many, many, many tools that can be used in doing person-centered planning. And remember, person-centered planning is not the document that comes out of the process. Person-centered planning is the whole process of getting to know a person, helping to surround that person with the right supports, the supports who will listen to them, get to know them, honor their choices and preferences, and think about what are their skills and assets in every aspect, every life domain. So person-centered planning is a way for people with intellectual and developmental disabilities to plan for their lives. It builds on their strengths and honors their choices, preferences, and abilities. It's required by state and federal law for people who receive behavioral health services. And we didn't make this stuff up. This isn't just Mary and Sola and Jan Lampman and Vicki talking about this stuff. That's in the mental health code. And you see the reference there at the bottom. So again, we want you to think about supported decision making. Doing a person-centered plan is one aspect of how you can help support a person's decision making about services and supports they might need over the next time frame, whatever the time frame of the plan is. Usually it's a year. So let's go on to the next slide and tie LifeCourse tools into this. So LifeCourse, as I said, the materials put out by LifeCourse is just one tool you can use. There's maps, there's paths, there's essential lifestyle plan, there's all different types of tools. But this is a newer tool that was developed by the UCED, which is the University of Excellence in Developmental Disabilities, Missouri, out of Kansas City, Missouri. And they developed these tools, and it's a very easy kind of process to help somebody plan their trajectory. And that trajectory could be their person-centered plan at a behavioral health program or organization, or it could be just you or I just saying, okay, I want to buy a new car. I'd like to have that new car in a year. How am I going to get from where I'm at now with the old vehicle I have to that new one within 1 year? So these tools can be used for lots of purposes. They can also be used by an organization to say, okay, here's where we're at now, say, in terms of our cultural diversity work, and where would we like to be as an agency 5 years from now? And these tools can be used as an agency to help them put that plan in place. So as you see on the slide there, a vision for people with IDD and their families. It's helping to create that vision that then can be written into those formal plans from various programs or organizations that the focus person gets supports from. It provides information to the individuals and families that will empower them to lead the discussion for planning a good life. And that's really the focus of LifeCourse, helping a person figure out what is a good life, and what we each think of as a good life is different. There are things that Sola likes that I probably don't like at all. And there are things that I like to do that probably Sola would be like, yeah, no, not my idea of a good time. But it's up to each individual person. So again, figuring out that trajectory of what a good life is. Here's where my life is now. Here's that trajectory of how to get me to a good life. It uses tools to plan and organize, and then a person can bring those thoughts and ideas into the service system. So for example, this year, when my brother's person-centered plan document was due to be in his file by the end of June, we got a call. We as a family had started using the LifeCourse tools, working with him at various times when he was getting together with various family members to fill out the LifeCourse tools, so that when we got the call from his case manager about 2.5 weeks before his person-centered plan was due, saying, oh, he's due. I just figured out he's due for his meeting. We need to get together and do a pre-planning before that. He came to the pre-plan and handed her all of the paperwork, all filled out. This is what I want for the next year. And he had gleaned that by meeting individually or in small groups with various family members, people from his church, people where he worked. And so she loved it because it was really easy to do pre-planning because she already had a lot from him. He's a man of few words. And his case manager, which was his 6th case manager in the last 2 years, they've averaged about 6 months. And so it's really hard to get to know him in 6 months worth of time, especially in the midst of a pandemic when you can only meet virtually and technology is not something he really enjoys. He doesn't really enjoy Zoom meetings. So at his person-centered planning this year, though she had been his case manager for almost 6 months, was the first time she actually had met him. And so having all of that document filled out by his circle of support and people that have known him for years, and which seems like forever, actually he and I met in high school, which for me was just the other day, okay, I graduated in 1980, so that tells you how old I am. So we've known each other for 40 years. And so for a new person to come in and assume they can get from him what the trajectory is of what he wants to work on over the next year, it's going to be really difficult. So it's helpful to use some tools, whether it's LifeCourse or one of these other tools that we talked about, to help kind of bring the conversation together. And so what LifeCourse can do is it links, there's links on the DD Council website that will help you to get to some of the tools. And we're going to share the website for LifeCourse tools for you to explore more a little bit later. But before we get to that, we want to kind of go over more in depth kind of how LifeCourse helps people figure out these trajectories. And the trajectory could be, how is this young adult going to make decisions in their adult life? And figuring out where are the areas where they need support, how can that support be achieved? Who do we need to surround them with that can provide support for this life domain or that life domain? So it's really, it incorporates the concepts that the family would be involved from beginning to end. And family means something different for each person. I'm not biologically related to my brother, but he will call me his sister and I call him my brother, and it's been that way ever since high school. So whoever their family is or whoever their circle of support is, it helps those individuals have a chain of interaction with the service system and put it all together so that all that information can be written into a plan that really makes sense for the individual. It encourages the individual to dream and to think about their vision of what a good life is. And it asks what is needed to really get that person to that good life. Now remember, we showed a few moments ago what it says in the mental health code about what person-centered planning is supposed to be. Notice the law does not say the choices and preferences and ability of their guardian. So people under guardianship, it sometimes is more difficult to really do a true person-centered plan because so much is just thrown into the lap of a guardian. And as Sola, pointed out earlier, not every guardian knows the ward, and not every guardian has even met the ward. So when you think about that circle of support, that's what we really want to use as our foundation for getting information. People who the individual has chosen to be part of their life, and people that person, the focus person, knows and trusts. So let's go on to the next slide. Go ahead, Sola.
I mean, from what my experience as a professional guardian, the professional guardians only see people as, I don't think they see them as a person at times. Sometimes I think they see them as free money. And they only have to do the bare minimum in their care.
Right.
That's my personal opinion on it. From my experience, seeing my siblings, seeing my sister have a professional guardian, my younger brother having a professional guardian.
Right.
I think I think they only see them as a paycheck, and they only have to do the bare minimum to maintain that paycheck.
Right. So providing 3 square meals and a roof over their head, and sometimes 3 square meals and a roof over their head can mean something really different from person to person. As you so poignantly pointed out earlier, the guardian was in some situations with your family members were doing the bare minimum, and their idea of what a good roof over their head might be vastly different than what the family or the individual was hoping for. So let's talk a little bit more about LifeCourse. Anything else that you wanted to add there, Sola, before we move on?
I think with the person-centered plan, I don't think the guardian doesn't care about the person-centered plan. I think the provider network or whoever the person is seeing, they outline the person-centered plan, because I think that if someone is independent, they believe that they'll have a better say, that they are, I guess, worthy of having a say in playing their stuff out. If someone's under guardianship, they think that that person gave up their right to have an input, and they just said, just take your meds and follow our counseling program, and and it's all you have to do, and that's all we need you to do.
Well, and I can attest to the fact with my own family member that he is so used to hearing all of his friends and people that he knows, a lot of them have guardians, and it's just kind of you just do what your guardian tells you to do, and you don't have to think about things. So in many situations, it's almost a learned helplessness develops. So to the point, I see this all the time, even when I go to a restaurant with my brother, the waitress will say, "And you, sir," she'll go around the table and take everyone's order, and he'll look at me like I'm going to order for him because he's so used to people, speaking for him, and he hasn't had a guardian. He's been an autonomous adult his, I wouldn't say his whole life, but most of his life. But he got so used to having other people speak for him that he sometimes forgets that he needs to speak up for himself.
Yeah,
And when
I'm
he
sorry.
does, you feel like you're pulling teeth to get information on what he really wants. Go ahead, Sola.
And with my sister, she was adamant about not having a guardian. And I mean, there was a few people that were like her at first who were just trying to fight it, and then when they couldn't fight it, it looks like their spirit was broken. They're like, they just have to do whatever the guardian and their case manager says.
Yeah. I often share this when I do presentations. Years ago, back in the 1980s, when I was first, working in the field of rehabilitation in the state of Michigan, and we were really talking about person-centered planning starting in the early 80s. And I said to a person, if you could have any job in the world, what would it be? And the look on this person's face was total shock. And I almost felt like they were angry at me for asking the question. And I said, why are you looking at me that way? And they said, well, nobody's ever asked me that. And this man was 37 years old, and nobody had ever asked him what he wanted about anything. That was his perspective. Nobody's ever asked me that. And so we started talking about what jobs, he felt he would really enjoy, what kind of work would, does he have the skills to do, and those kind of things. But when we think about it, that often happens in a full guardianship situation where the person just stops dreaming because, well, I don't get to decide anyways. My guardian decides all that, so why bother? We do have a comment in the chat. Vicky was saying, someone else determining your goals, do not make them your goals. This does not set up success. So I agree totally with what you're saying, Vicky. So when somebody else determines what your goals should or could be, you oftentimes, as a human being, just want to do the opposite. We see this all the time ourselves in health situations. The doctor says, well, you need to cut out coffee. Well, for me, that's a lot easier said than done. If you tell me to cut down on caffeine and to come up with my own plan of how to do that, I can do that. But if somebody else makes the decision for me, I really want to fight it. That's just in my human nature, and that's the case for many people. Like we mentioned earlier with relationships, if you tell me I can't see this person, that's going to be the person I want to see the most. And so when we look at a tool like LifeCourse, like you see on the slide now, the principles of LifeCourse, there's the concept of all, and you see is the right how they kind of define that concept of all. It's not just looking, as Sola pointed out, at the person as a person with a disability. It's looking at the person, as the whole, one member of the community at large, one member of the American society. So we don't just look at what are services and supports that are eligible, that this person's eligible for, but we look at where do any other people that are their peers, their same age, same area of the state, where do they do those things? And we look at that rather than always going to the service system first. And in LifeCourse, we put people in the context of their family. So we address cultural, religious values, We address family dynamics. All of that is looked at in conjunction to the person. So we look at the whole person. And then there's a trajectory of experiences across the lifespan. And so there's tools that help to kind of put together from birth to death. So sometimes LifeCourse tools are used for families with very young children, figuring out what are their needs going to be as they grow, as they change, and teaching decision-making skills to very young children. You saw in the video that we showed the very first presentation in January, you know, the professor that talks about that out of Saginaw Valley talks about, you know, this starts with the, as she says, the itty bitties, you know, choosing what style or color of lunchbox, or what shoes to wear that day, or what colors, you know, what clothes to wear. And if the clothes don't match 100%, that's a choice that they're making. And honoring that choice for a very young child is just the beginning step at teaching those decision-making skills as they grow and change and mature. And so you don't want to think about these tools coming into play when the young adult's about to turn 18. You want to think about using these tools at a very early age. So again, LifeCourse tools are designed to be birth to death. And then it's about achieving life outcomes, picturing what a good life is for that person and how do we get there. Caitlin, can you go on to the next slide, please? Okay, so on this next slide, we talk about exploring LifeCourse domains. As I mentioned, it's birth to death. And it also covers each of the life domains. So daily living and employment, community living, healthy living, safety and security, social and spirituality, advocacy and engagement. So we're not just isolating one aspect of a person's life, like what are the services and supports they're going to need. We look at all these aspects. Where are they going to live? How are they going to, you know, interact with the community around them? What advocacy? How are they going to stay engaged in their community? The different communities that they choose. We do talk about safety and security, but for so many people with disabilities, and for so long, that's the only aspect that we think about. We forget phrases like the dignity of risk. We all take some risk. And I will tell you, despite the fact that my doctor has said it would be better if I stopped drinking coffee, I still drink it today. But I've cut back and I've switched the kind of coffee that I drink. And I've learned that when I get up in the morning, it doesn't have to be a hot cup of coffee. It has to be a hot cup of beverage. So I can sometimes choose hot beverages that don't have caffeine. But again, if you tell me that the trajectory of where I need to be, I like to control how that happens. And that's no different for people with intellectual and developmental disabilities. And a LifeCourse framework, the LifeCourse tools are just one way to help them figure that out. Okay, so LifeCourse domains help us think about the current realities in our lives, while also thinking about what life experiences we want to have and which leads us to that good life that we want. So go ahead to the next slide. So here, the 3 strategies for supporting individuals and their families can be organized into 3 categories, or what we call in LifeCourse framework, the buckets. Discovery and navigation, having the information and tools you need to navigate life. When we think about that bucket for Soulless Family, they never had that information, or had tools explained to them about things they could use other than guardianship. And so that's a really important bucket. You want to fill that bucket up with information and different tools that can be used for each family member. The second, go ahead, Sola.
For the buckets, for the information, way back when the first guardianship thing happened, our only information were given to us by people within like the house care, because our family was under my dad's commercial insurance. So whenever there was like 1 or 2 many hospitalizations, the insurance would be like, this person needs guardianship. We can't have this person on our we can't have this person, we can't pay for this person anymore. We got to hand them over to the state, and the state can cover their costs.
Right. And so
most of our information, most of our tools was supplied by people who were paid by the for-profit, by commercial insurance and
right.
stuff.
And you were telling me earlier that there were so many services and supports that you didn't know were even out there because you never had that information of what your family was eligible for. And so that is a piece of it, but also just thinking about each family member in the context of all, whatever age the person is, what do other people that age, what aspect of their life are they in? What are the things that think about? What are the skills and assets that they're developing in that stage of life? So thinking about all of those things, thinking about each individual family member and all those things together is a way to help put a good trajectory together, one that makes sense in their lives. So this second bucket, thank you, Sola. The second bucket is connecting and networking, making the connection with peers and resources to help you navigate. So this could be helping to build social capital, helping to introduce them to people, a family member, to people that make sense in their lives. It might be somebody if they want a job working in the food industry. It might be somebody another family member or your brother's, uncle's, cousin's friend that works in the food industry, to give them more information about what it's like to work in the food industry, or give them an opportunity to job shadow. So again, connecting and networking. We all try to build social capital. And this is a case for community inclusion as well. You can't build community inclusion and social capital if you're segregated. So the more people you have an opportunity to meet within a community that you want to be in, the more social capital you can build. And then this last bucket, goods and services, the day-to-day tangible items you buy or use from public and or private organizations in your community. So it's important to think about supports from all three of these buckets. But traditionally, we only go to services, goods and services that are eligibility specific. And so as we go to this next slide and talk a little bit about the STAR, you'll see it's important to think about not just one of those buckets, but all three of those buckets within every life domain for an individual. So this integrated STAR, it's called the Integrated Services and Support Across the LifeCourse STAR. Individuals and families access an array of integrated supports to achieve their envisioned good life. These include those that are publicly and or privately funded, community supports that are available to anyone, relationship-based supports, and technology come into play here, and then personal strengths and assets of the individual and their family. So we're going to go on to this next slide. I'm looking at the time here. So we talked about Sola kind of introduced some of the LifeCourse tools to her so she could think about the context of her family in using the LifeCourse framework. And so this shows a STAR that she started to create, just thinking about a recent surgery she had and how she wants to get back physically to where she was and the things she was able to do before the surgery. So you can see, she had no formal training on LifeCourse. We shared the website with her, which is on this slide, www.lifecoursetools.com, and you can print out blank tools, all of the different things that we're going to talk about for the remainder of the presentation. But you can see how easy it is to get started. Sola, do you want to share about your STAR a little bit?
Okay. Well, since most of my family members, they're in like a living situation where I could say that they're in like stable housing. And over the past 2 years, my health has taken a turn it hasn't been really, really good. So I recently had surgery on 2 torn ligaments in my ankle, and right now I'm at the point where I can start physical therapy.
Mm-hmm.
And for me, going to physical therapy is a great thing. But my biggest issue is transportation. I realized that in the green section, I have all the supports and the coverage. I got medical coverage. I did a lot of research and asked around my insurance, and I found out that they can cover up to 30 days of taking me to and from my appointments.
Yeah. So
And
you see the green area. I just wanted to point out, Sola, to everyone, at the bottom here in the green, it says eligibility specific. So that is an area that we do want to look at. So you, when you did some research, found you were eligible for a lot more things than you even realized.
yeah,
Okay.
and I think it was kind of hard for me to do the STAR at first because I'm used to finding eligibility things for my siblings. It was hard for me to get used to taking care of myself and I had to tell myself it's okay to take care of myself. I was really uncomfortable. I was like I had an all or nothing mindset for myself.
Right.
So
I'm going to
I,
move you over to this blue, or I don't know if it's considered blue or purple. My color vision is not so great, where it talks about community-based services. Tell us what you thought of when you got to that portion of the STAR.
I, when I got to that portion of the STAR, I thought of, well, I need a backup plan just in case my insurance ride doesn't show up on time or doesn't show up at all. I can schedule a ride through the Smart Connector or the community transit service.
So those are community-based services. You know, there's just thinking in terms, if we were all part of Sola's circle, we might also suggest things like Uber and Lyft. Of course, then that costs money. So figuring out that you can't just think of that isolated in and of itself. You have to think about how that affects a person's budget and, weigh all of those life domains together. So those would be community-based services that, again, thinking of SOLA in the all, that any person could utilize.
Yeah. I could use public transportation, but if it's physically feasible for me, because right now I live a half a mile from the bus stop and I can only make it up one block and back home. So
your ability to walk the distance to get there has changed.
Yeah, and with the community-based services, like the community transit service, it'll save me a lot of money from depending on the rideshare apps because the rideshare apps, they're convenient, but the costs add up.
Right. So let's move on to the red area. What did you put under technology when you were working with the STAR?
Well, I have my internet, I have my phone, I have my tablet, and I have rideshare apps.
Yeah. So all of those are assistive technology that you can use to reach that trajectory of getting back to the public transportation. What about the top area of the square here in sort of the teal or aqua color?
Oh, okay.
Personal strengths and skills.
Yeah, this part I admit was the hardest for me because I would usually, when I think of my own personal strengths, I would only think of what people have told me of things. They told me that I'm responsible, I'm patient, I'm generous and stuff. And sometimes I associated those compliments with stuff what I did and not me as a person. So I had a hard time kind of just saying, "Oh, they're complimenting me as a person," and that's stuff I was doing for my family.
Right.
So
but now you know those same strengths and skills can help you do things that you want to do just for yourself.
Yeah.
Yeah. So this last area is relationships. So there might be somebody in your life that has a vehicle that could get you to the bus stop, or there might be somebody in your life that has a golf cart that they use to get to the grocery store themselves. Maybe that's, you know, they could drop you off at the bus stop. So those relationships, you can see how building social capital and thinking about a person in the context of their whole community and their whole family can help reveal supports that you might not have thought about otherwise. Let's go on to this next slide, if you would. We just have 3 more slides, and we're going to leave some time for questions at the end. So this slide talks specifically about using LifeCourse tools in figuring out decision making. So there's a star, and you kind of got an idea of a star. This is a sample one that's already filled out. And those are things that you could think about in each area of the star, whether you're thinking about relationships, eligibility specific, community-based supports, technology, or personal strengths. And I recommend you always start with personal strengths and skills. What do you already possess? What either knowledge or physical skills or material things do you already possess that can help you reach whatever the trajectory is that you're trying to achieve? Whatever that vision of a good life, the portion that you're working on right now, what do you have now that can help get you there? And then you see on the right of this slide, kind of, it walks you through exploring decision-making supports, what the person decides for themselves, what they need some support on, and what may need to involve somebody else to help more, more intensely with a particular decision-making skill. So again, using LifeCourse tools, it just walks you through all of that. Now, I want to again say these LifeCourse tools are available in 2 areas. This particular star and this resource is not only available at lifecoursetools.com, but it's also available at the Michigan DD Council webpage, which is listed here at the left of the slide. If you go about halfway down that page, once you get to our webpage, you'll see a button that says supported decision making. You'll see the video that you saw in the first January's presentation, and you'll see these LifeCourse tools as well. Now we want to go through some additional resources. Again, these LifeCourse tools can be used by yourself with a goal, just in the way that Sola used it, to think about, wow, after my surgery, how am I going to get back on my feet and get mobile again? So she's starting to work on that LifeCourse star to help her get there. But there's also tools that figure out trajectory to give you what they want in their life and what they don't want, and start to figure out that trajectory of how to get them there over a period of time. I want you to go ahead, Caitlin, to the next slide, please. And in this slide, it talks about additional resources. So if you want more information about LifeCourse, you can go to either of those 2 websites and get it. My contact information is there, as well as information for Jan Lampman. Sola has asked if you have specific questions for her and how she's using LifeCourse tools, and we'll kind of start to use them with different family members. Just contact her through Jan or I, and we'll put you in touch with her or get the question you have to her, and then we'll get that response back to you. And then the ARC has information about supported decision making and lots of tools, as well as Michigan Alliance for Families. We do have some LifeCourse ambassadors in the state of Michigan, and some of them are also employees of Michigan Alliance for Families, as well as the DD Council. If you go to the next slide, there's also a lot of YouTube channels that actually have people talking about how they've used LifeCourse tools and how they've used that to help them in their supported decision-making approach. We're not going to go to those, but Caitlin, if you're able, I'm going to have you show the slides that show some of the other LifeCourse tools. Are you able to pull that up, Caitlin?
You just want me to pull up some of the links on that slide, correct? Yeah. Give me
the LifeCoursetools.com, if you could bring us there.
Yeah, I have that up.
Okay, so you see here what the LifeCourse tools.com page looks like. And you can get a LifeCourse library that actually shows different forms that you can use. And so if you would scroll down a little bit, Caitlin, on the page, and go to where it says Library of Resources and click on that. We'll just give it a minute here. So all of the tools that we're talking about, you can watch a video and keep scrolling down if you would. And again, it just explains everything that we just talked about. Keep scrolling if you would. Pause there for a moment. And then you can click where it says Learn More. It'll talk about, you know, focusing on the all, recognizing the person within the context of their family, the trajectory of life course experience across the lifespan, and achieving life outcomes. If you click on those, it'll actually show you specific forms you can use to help you in that particular area. And then if you would slowly just scroll a little more, you see all of that information. And again, if you click on Learn More, it's going to show you specific forms that you can use. And what forms you should use depends on the individual, where they're at now in life, where they want to be. But as you look at these, you'll see different forms that just make sense. And so if you just want to watch a video specific just on LifeCourse, you can look at the video and get a whole introduction yourself. So you can do your own mini training just by going to the website. So it's 2:21. We have about 9 minutes and we wanted to save time for questions. So again, all of these tools, Caitlin and Vicki have been kind enough to drop them in the chat boxes. So you have all of that. So we want to reserve this time for questions. What questions do people have either for Sola or I about LifeCourse tools and how those can be used in supported decision making? Caitlin, do we have any questions at this time?
Nothing's popping up in the chat quite yet, and I don't see any hands raised.
Okay. I'll ask this question of the audience, and Sola, I'm going to include you in this. Hearing more about LifeCourse tools and how they could be used, is anybody thinking this is something I want to try more?
Oh, yes.
Okay. Tell us how you might use those in the future.
Well, I would use them if I have like a specific goal that I want to that I want to go for, or if I'm having like some sort of issues and stuff, I could use the LifeCourse tools to try and sort those things out. And I think the LifeCourse tools can also help my younger brother try to, I think, to assert his rights and just to be more assertive and push and make a better case for him, a better case for supported decision making.
Yeah.
You have Andrea, her hand up.
Go
Andrea,
ahead.
Hand up. Andrea, you want to unmute and make a comment or question?
Hi, no, I was just saying me when she asked who thinks they would be using this. So that was just me. I would.
Good, thank you.
I have those moments. Pick me. I mean, when I saw the LifeCourse tools and being part of my brother's life since we were back in high school in the 1970s and 80s, gosh, that makes me feel so old just to say that. But it was like this aha moment for me, and I've been trained how to use action planning, maps, paths, essential lifestyle plan, all of those kind of tools that were kind of talked about in the 1980s. And when I saw LifeCourse stuff, I'm like, that's it. That's what's really going to work with my brother. And so literally, as Andrea, I think you're the one that put in the chat box for the next PCP meeting, it was so great. And this case manager who is fresh out of college and literally had not met my brother in person and was charged with writing his goals for the next year from the agency that she works with. It was so helpful to her, and she was so grateful that all these people who had known him for years and you know, from his church, from his job, from his community, there were neighbors there were family members there. That was her only way of really getting to know him, and she got to know him very much from all of those forms that we had filled out. Okay, other questions or comments? Okay, Sola, I'm going to give you the last. Oh, I'm sorry, Vicki.
Oh. Yeah, Amy's got her hand up.
Okay, Amy, go ahead. You'll have to unmute though.
There you go.
Sola, I'm so proud of you for doing this. I know it's hard to talk about your story, but I'm so proud of you for doing this. Thank you for helping too.
Oh, thanks, Amy.
I think, Sola, I want to add to that. We all want to think of the best parts of our lives and not think about maybe sometimes that we or a family member struggled. But it's important to, when you talk about the struggles, I mean, think of the social capital, Sola, that you're building by being able to share your story and the people that you've met. And just even today, you know, you were talking about, like, I'd like to do this, but I need to think a little bit more about that, or I need some help to think about it. You and I have met now, and, you know, you can count me in. Like when you need to learn more about supported decision making or something's coming up with your family, you know, you've built that social capital. And I know it's not always easy to share stuff about your family, as Amy just said, but I want to thank you as well, because I couldn't have done this presentation without you, literally. I think it's so important that we see how the things that we're talking about really look like in the lives of real people in Michigan. So I want to echo what Amy was saying. Thank you so much for being here today, Sola.
Oh, thanks. Oh, you're welcome.
All right.
All right. Thank you, Mary and Sola, so much for your presentation. So we did have a comment, one more comment in the chat. I didn't realize a person with a developmental disability could sign contracts. Well, they can, unless they have a guardian who takes that right away. So, you know, if a person has a guardian, then your legal ability to do that is taken away, which even includes, you know, getting a cell phone, because you have to sign a contract for that. And the guardian has to sign the person-centered plan or the plan of service. So what I really learned from this, or reiterated to me, is that guardianship doesn't always address what the person really needs. And
right.
Sometimes you really miss that or really hinder what the person needs. So thinking about what other tools that can be used, especially I am such a proponent of person-centered planning. I think it's a great tool. It helps anybody, whether you're getting services or not, develop life goals. And we all have an opportunity that we want to develop life goals. I've mentioned in past trainings, I did it with both of my sons, and not so formally or written, but once they graduated from high school, we talked about what are your goals, how are you going to achieve them, who's supporting you, all those things that you look at when we do person-centered planning as well. So just a reminder, so we're going to wrap up so we get you out on time. Social workers, CEUs, if you'd like those, you have to complete the survey. We'll be sure that you get the certificate for that. Anybody else, please can also complete the survey, because it helps us give feedback to our presenters and helps us plan for the future trainings. Next slide. So our next session, as Mary had mentioned, is August 23rd. It will be on assistive technology. Norm Delisle will be our presenter for that. Norm has been around for many years, a great advocate, and will provide us a lot of information about assistive technology that helps people be part of their community and remain independent. And then we have, we have 3 sessions left this year. September will be about healthy relationships, and October will be about how peers can support people to be as independent as possible. And we lost our, I need to go back a slide. Okay, next slide. And as I had mentioned, we do have all of these sessions are recorded and on our website all the way through May. June's will be on in a week or two. I mean, sorry, all the way through June. July's will be on in a week or two. We just have to do a little bit of editing before we put it on there. So if you go to our website, click on recorded training, scroll down the supported decision-making series. Caitlin's put that link in our chat as well. If folks have questions about or want information about these different sessions, all of them were great. They can go to that and listen to they're all an hour and a half. Next slide. Thanks again for attending our training. We so much appreciate it. The trainers and Caitlin and I will hang on for a few minutes in case anybody has any questions for us. Otherwise, this is the end of the training. Don't forget to do the survey. Thanks again so much for being with us. We hope to see you in some of the future months. Take care.
And I just want to add, if
everyone.
any organization wants more information about LifeCourse or would like to have a presentation specific to that and the use of that, they can contact me at Michigan Developmental Disabilities Council. All the staff's contact information is on our website, and I can line up a LifeCourse ambassador to come to your organization to do a presentation.
Thanks, Mary. Great.
No problem. Thanks, everybody.